Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Palaash, and Palaash is 12 years old. He's my new co-instructor, and he has autism. And we are here with his mom, Nemu, as well. Palaash is able to communicate by typing in what he wants on a keyboard, but he's unable to speak verbally, and his parents are really working so hard to improve his oral motor awareness and his ability to perform copy actions with his mouth. And in order to do that, he has a lot of dyspraxia on the movement of his mouth, the strength of and the range of motion of his oral motor structures. So we are working on the Weber Photo oral motor cards, and we're currently doing the lips. And these that we're about to do are quite tricky for him. So let's see how it goes.
Yeah. So here we are actually working on strengthening of the lips. The first one is the lip rub that we do with the lip balm kind of a thing, which he's not able to. So here we are going to do rub your lips together like you're putting on a lip balm. So what I'm going to do, Palaash, is I'm going to help you. So I try to use 2 tongue depressors here. I use a bigger one for the lower lip and a small one for the upper lip. And I'm trying to get his lips curled up this way. And Palaash, good. Can you open? Yes.
So you're trying to use the tongue depressor to curl that lip in.
Yes, curl both the lips in so that he gets the motion going there at least. So listen. Yes. Yeah, keep it like this. Okay. Hold it for 10, Palaash, okay?
2, 3, 4, 5, 6, 7, 8, 9, 10. And it's really that upper lip that looks like he's really struggling with.
Yes, it's very tight, and we need to work on that upper lip to curl in. The lower lip is still curling in pretty good.
But it looks like when you try to put both of them together, he's really having trouble with the bottom lip too.
Yes, it tries to come out when we are trying to, but the whole lip rub is a tricky part for him.
So we're really not even to the rubbing part.
Not yet.
We're just trying to get the closure of the lips totally
one over
sealed.
the other. Yes,
with
but
the
we're
lip
still
part
using
sucked in.
Yes, and using a tongue depressor in between. So it's more like they are doing a lip together with a tongue depressor in the middle.
And we did 10 seconds. Is that what you usually do?
Yeah, I'm trying to build slowly, but right now we are at 10 with the lip rub here with Palaash. So the next one is the straw hug. It's more like holding a straw.
I had trouble with this one myself.
Hold a straw between your top lip and your nose. So the whole thing is,
gosh, you're good at that.
Holding the straw with your, more like a mustache kind of a thing. So he's having trouble even doing this. So what we do is, I try to make him squeeze his lips. Squeeze your lips together, Palaash. And squeeze and hold it. So what I'm trying to do is, squeeze your lips together. Again, here is the upper lip. So I'm just doing this right now for him to understand what we are trying to teach him.
1, 2, 3, 4.
Whoa! As long as he can hold it. So that's where we are right now with this one.
That was a really good try.
Yeah. So this one says, hold a straw between your top lip and your nose.
And a lot of these, we started off with physical assist, such as this.
Yes. This one is, this needs a lot of assistance right now.
I'd say this is one of the hardest ones.
Yeah. And the last one is also holding a tongue depressor tightly between your lips. So he's actually holding a tongue depressor, but
it's not tightly.
Yeah, it's not tightly because the upper lip is still not curling in enough. So
that's some.
It's just holding. Like if I try to pull it, it's going to come off. So we're just making him hold. 1, 2, 3, 4, 5, 6, 7, 8,
you got it.
9, 10. It's just being placed between his lips. It's not like he's holding them.
And
because
he's not able to put it up there himself.
No, he needs assistance with putting it also. So hold the tongue depressor tightly between your lips. Again, here I try to read the cards before and after, and try to do at least 10.
Cement it into his brain
Yes.
what that movement is.
Yes, and at least try to do 10 holds or 10 seconds. A count of 10 hold is what I'm working on right now.
And you do these 1 to 3 times a day, the series of all of these cards.
Yes,
Right.
yes. So it's kind of a 40 minutes to an hour that we do all these cards. When we start off till the time we are done, it takes almost like.
And you didn't
let's
start
say-
off with all the cards, right? You
No,
started
we
off.
started off with 5 cards and then gradually increasing it to maybe a 25 right now.
It's quite a commitment.
But they still have, like, they have 50 cards and we don't have all of them mastered yet, or even doing all of them with him yet. So this is where we are right now.
I hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
Thank you.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.